Hi, my name is Dr. Dwight Reynolds. I am the president of Centers for Health Promotion here located in Coral Springs, Florida. Earlier today, we had the honor of having Pastor Toby Philpart, who is the moderator for the Florida East Coast Baptist Association, who's one of our major outreach partners. By the way, we have a little bit over 125 outreach partners to help us get things done, accomplished, from Okeechobee County, through Palm Beach County, through Broward County, and Miami-Dade County as well. Just to give you some idea about me, who I am, again, my name is Dwight Reynolds. I'm a medical doctor. I've been board certified in emergency medicine since 1985, approximately 38 years, I guess. I've been a physician for almost 45 years, became a physician in 1978, a graduate of Michigan State University, College of Human Medicine. I'm also licensed to practice medicine and surgery in 13 states. I have been on the front lines of the fight against COVID since the beginning of its inception about 2.5 years ago. I witnessed firsthand the devastating effects COVID-19 has on our various communities, especially our communities of color, and which seem to be underserved and not represented well by therapeutic treatment and or vaccinations. Since the inception of COVID-19, there's been over 6,826,307 deaths across the globe. Here in our state of Florida, what's been recorded in terms of deaths is 87,141. Understand again that COVID still remains a threat to our Black and brown communities, and that's where we stand with that part of it. I have some good news, however. Although COVID is still around, we do have a medication called Paxlovid, which is an antiviral medication. As you know, with all antivirals, such as Tamiflu, which is used to treat influenza A, Paxlovid is very similar from that standpoint in that it is to be taken early in the process of you getting COVID symptoms. It should be taken anywhere between 2 to 3 days, which is the best, although they say up to 5 days. Sooner is better. And there's an 89 to 90% efficacy, that is effectiveness in killing the actual virus itself. You should also know that Paxlovid is also good to be used in children from ages 12 and up. As long as they weigh, I guess, 44 kilograms or roughly 88 pounds. This is very good news because we know that we will at some point or another perhaps be in contact with someone who has COVID or get COVID ourselves. And this Paxlovid, the antiviral, it kills both the original strands of the COVID, which was the alpha, beta, gamma, mu, and the delta, and now into the Omicron strand. So it kills all the Omicron strands as well. So it is a very powerful drug. The problem that we had been having was that it was not available to people of color, that is people that look like me that's talking to you now. And we also want to make sure that we cover the people that's in rural Florida, which are some of our Anglo brothers and sisters as well. So I'm so happy again to report that this medication is free and you pay absolutely nothing for it at this point. I might tell you, however, that as we move forward into the next several months, there will be commercialization. That is, the drug companies selling these Paxlovid for more than likely well over $600 per packet per dose. And again, right now, it's free. Take advantage of that because it really is helpful. The nice thing about what we're doing now also is that we're able to give you the Paxlovid antiviral medication before you come down with any COVID at all. Sometimes it doesn't matter. You want to get it into your hands now because I really feel very strongly that once you get the COVID symptoms, guess what? You're going to want to try to get a test somewhere. By the time you can do all of that, you will have wasted time. So what we're saying is that time is very precious in trying to defeat COVID itself. So Paxlovid is very important within the first 2 or 3 days after you have come down with your COVID symptoms. What symptoms am I talking about? Well, the basic symptoms for a virus basically is going to be cough, sore throat, perhaps a headache. You may have a taste issue. You may have a little bit of being fatigued, a little nauseated, may have some GI complaints, such as vomiting, such as diarrhea, those kind of things. But coughing seems to be very prevalent, especially in the Omicron variant itself. Okay, let's get back with Paxlovid. It is extremely effective and is known to have saved countless lives. We're talking about hundreds of thousands of lives, as well as decreasing the amount of severity of your symptoms. And who should be taking Paxlovid if we look at it as being the high-risk patients? That is high risk from when they get COVID, then they're most likely to get severe disease, hospitalization, and perhaps even death. And those people include, of course, African Americans, if you're over 50 years old, diabetes mellitus, hypertension, heart disease, obesity, sarcoidosis, lupus, sickle cell, HIV, post-traumatic stress disorder, depression, and much more. So this is a very important thing to understand, that most of us in our communities of color will have at least one of those things going on. So I think we're all pretty much, I would say probably 90% of us are at risk of getting severe COVID if you come down with COVID. So Paxlovid is very important for you to have. Also note that Paxlovid is the only medication right now that is allowable through the EUA, the Emergency Use Authorization, for the treatment of COVID. Remdesivir, which is an IV administration, is given over 3 days, and it's very costly, and it's usually given in a hospital setting. So right now, the only drug we have that is there to fight COVID, I repeat it again, is Paxlovid, Paxlovid. We have been really blessed to have a very solid Department of Health, and specifically, it's the Florida Department of Health Division of Emergency Preparedness and Community Outreach Support. And through that, I might give special thanks to Ms. Cynthia Weaver, who is a coordinator for the Paxlovid program, I should say, for COVID therapeutics, and to Mr. Victor Johnson, who is the Deputy Director of the Florida Department of Health Division of Emergency Preparedness and Community Support. I'll tell you now that it has been very difficult for people of color, it looks like, to get Paxlovid, but there's no longer any excuses. I've been asking on a regular basis, twice a week. We're able to get in a large number of Paxlovid dosages, and they're going like candy, kids getting candy to eat. I could guesstimate that over the next 2 to 3 months, we're going to go through approximately 100,000 dosages of Paxlovid, so I hope that there's plenty left in our reserves. Here in the state of Florida, I do know, as I understand it, that the federal government allocates to the state of Florida approximately 6,000 dosages of Paxlovid every week. And I want to make sure that it's very well understood that we're going to be using this probably to the tune of about 7,000 to 8,000 dosages every week, at least for about the next 2 to 3 months. So just putting everybody on notice that we know it's available now. I've been given the authorization to go in and request such a large amounts of Paxlovid to get in our communities. And I'm so happy that the two individuals I just mentioned, Ms. Weaver as well as Mr. Johnson, are committed to helping us out as we go through this major endeavor to keep our Floridians safe and healthy. So I'm going to conclude by saying that I want you to be able to, you're going to get the information at the churches and other organizations that we have partnered with, but you should be able to go into our website. That website is the Strike Force, the vaccinestrikeforce.com, or you can also scan the QR code that will take you directly to the landing page for Paxlovid. Again, the word is Paxlovid, Paxlovid, and it is available to you now. Thank you so much. Be blessed.